my name's Jonathan Abraham. I'm CEO and co-founder of Healum, which is a digital health and wellbeing system that enables healthcare professionals to support people with long-term conditions to manage their health. Joined today by Stuart King, CEO and head of distraction at BeeZee Bodies. Go back a fair way with Stu, but please, can you introduce yourself to other people?
Yeah, cool. Thanks for having me on, John. I'm Stuart King. I run BeeZee Bodies. We've been running for about 15 years as a program. We work with families and adults, children, young people, just trying to help them sort of make healthy and happy changes to their lifestyles, and really applying evidence-based to make sure that that's all done sustainably through the public health system.
Great. Well, look, it's good to have you with us, sharing your experience of running behaviour change programs and helping people to make healthier choices and helping to apply that to their health goals and losing weight in particular. Quite relevant as it's National Obesity Awareness Week, which is really important. Wondered if you could just start telling us a little bit about what you and your team at BeeZee Bodies do, and why weeks like, National Obesity Week are important, if it is indeed.
Well, what we do at BeeZee Bodies is we are sort of obsessed with translating the evidence base. I've worked in all the different areas of public health, from intervention design and the NHS and public health as an obesity lead, and in the local authority when we moved over there, doing all the sort of local policy and that stuff from a local level, but then also from Public Health England perspective in the national team, working again on the policy side and looking at sort of the national implementation of that policy. And now I'm full-time again with BeeZee Bodies as the full-time CEO and head of distraction. And we've always been about translating that evidence base, because I see lots of people doing great things on the ground, but they can't evidence it. And there's lots of really good theories, but they actually don't work in the real world. And so our whole mission for the last sort of 15 years of applying this stuff has been to take that evidence base, look at what really works in the real world, and then take the bits that work and get rid of the stuff that doesn't. Like Rory Sutherland from Ogilvy says, that you can't be snobby about where good ideas come from. And I think that is something that we can be a little bit guilty of in public health and in academia generally. What does National Obesity Awareness Week mean? It's a good question. I don't know the answer to that. There's if you look at the sheer number of weeks and days and months and stuff that exist, is quite exhausting actually. But I suppose the thing that it can do is just focus the mind. It gives you an opportunity to do stuff like this, I suppose, like have chats about things that are going on in the world of obesity. But I don't know what I'd be really interested to see what the impact of a day like this or a week like this is actually. But in my view, it's just an opportunity to have interesting discussions with people.
So, taking a step back, if we look at the problem with sedentary lifestyles, with obesity, with the challenges of managing people and people managing their lives to make sustainable, consistent changes and be healthy. Having now worked in this space for 7 or 8 years, and having had an interest in this space for 15 years and previously been overweight and borderline obese myself, I'm fascinated by each year. It doesn't necessarily seem like the figures change that much. We've still got 28% obesity in England, with a further 36% of people being overweight. And look, that might have changed a little bit between 7 or 8 years ago, right? But the facts were still about the same then as well, right? So it hasn't changed that much. Yet, a lot of attention, time, energy, money has been put into trying to tackle this problem at a systemic level and through commissioning great programs. But here we are, and the stats broadly sound the same. It's not like they've changed that much to go, oh yeah, we're on the right track, we're making progress. So I'm just fascinated to understand from your perspective, like what is going on? Because you've worked even longer in this space. You're like 20 years in, even though you don't look that with your sprightly, youthful good looks.
Thanks so much. Well, I mean, I would go back and challenge some of your assumptions. Has a lot of money been spent on it? Has a lot of time been spent on it? There's certainly a lot of talking that goes on around it, and it has done since, well, certainly since I got involved in 2004. But I mean, Foresight came out in 2007, the Foresight paper where they had the obesity systems map. Really interesting paper, ridiculously hard to understand, even harder to apply. Still makes sense today. If you go back to 2007 and look at that 2007 paper, the Foresight paper. But in reality, has a lot of money been spent on it? Piecemeal money's been spent on it. A lot of people have said things that we should be doing and stuff, but it's actually been very individualized, siloed working. And I know we've got now, in the last couple of years, we've done a lot more talking and thinking about whole systems approaches to obesity and generally whole systems approach in health and well-being. But that hasn't happened en masse. You've still got small pots of money being spent by local authorities and public health teams. You've got other elements of the obesity system through the CCGs and soon to be the ICSs. It isn't connected enough. And I said something I pitched something recently. Wasn't going to talk about this, don't know if I should, but I pitched something recently to government, which was what we call my Jerry Maguire idea, because it's sort of a huge sort of moment where I just thought this is not going to work. And the bottom line is we've got services being commissioned all over the place in a competitive environment. Yeah, and we're one of those competitors. BeeZee Bodies is an organisation that operates in this space. Are we going to crack obesity by all of us individual organisations that work in obesity, and that might be at a preventative level, it might be at a treatment level, but are we going to crack that by keeping the best stuff to ourselves so we can win the next contract? Because when we get asked, by national government or whatever, what's the absolute best stuff that you do? We're in a competitive environment. We're not incentivized to tell the truth about that, really, and that's a really sad fact. Because in reality, if we are really going to tackle this, then it's about sharing the absolute best of the best, not keeping the best of the best back so that you can have a competitive advantage. It's weird for someone who's in the business of trying to win those contracts to say something like that, but that's just the system that we find ourselves in. What we should be doing is creating a system where we can share that information, and people in Bradford could learn from people in Bristol if they want to work with Asian men, say, for example, and they should be able to look at the evidence that they've got. They should be able to look at the collateral they use to recruit people into their services, how they actually work with them, etc. So I don't think, actually, on reflection, that the system is particularly facilitative of us cracking the whole issue. I think there's loads of really good pockets of amazing work going on. I certainly class the work that we're doing as being particularly innovative and stuff that I'm really proud of. And we are sharing as much as we can about that as well. We are trying to do that. But the system at the minute just doesn't facilitate us cracking this problem, if I'm brutally honest.